Well, hey, everybody, this is Robert, and welcome to Outbreak News TV. And on today's news post, we're going to look at Florida man diagnosed with a tapeworm in the brain. And this comes from a case report in the American Journal of Case Reports published last week. And I'll give you a little background. I'm going to take a lot of this from the abstract of the study. Cysticercosis is a condition caused by infection with the larval form of Taenia solium, the pork tapeworm, that uses pigs as an intermediate host. Humans become infected when they ingest water or food contaminated with tapeworm cyst. Cysticercosis is increasing in frequency in developed countries due to increased access to travel. Now, neurocysticercosis, which this gentleman had, occurs when Taenia solium cyst, Taenia solium is the parasite, embed within the nervous system. The clinical presentation of neurocysticercosis ranges from asymptomatic to life-threatening, largely depending on the brain parenchymal involvement. The diagnosis is typically made with a combination of clinical evaluation, serology, and neuroimaging. Treatment for parenchymal neurocysticercosis may involve anti-helminth agents, symptomatic agents, surgery, or a combination of the methods. Now, the case is a 52-year-old man with a medical history of migraines, complicated type 2 diabetes mellitus, and obesity. He presented with a 4-month change in his migraines becoming severe, worse over his occiput bilaterally, and unresponsive to abortive therapy. His exposure history was unremarkable, except for, this is key, a habit of eating undercooked bacon, by which he would have developed neurocysticercosis via autoinfection. And we'll go over that in a few minutes. Neuroimaging and serology confirmed a diagnosis of neurocysticercosis, and he was treated accordingly with antiparasitic and anti-inflammatory medications. And they conclude that the presentation is nonspecific and could have been easily overlooked, especially if there's an underlying known neurological condition, such as migraines. This case illustrates that neurocysticercosis should be considered when an existing neuropathological condition displays a change in presentation or requires a change in therapeutic management, even without obvious risk factors. So let's take a look at the life cycle of Taenia solium. And if we look at the red circle, that's taniasis. That's when an individual eats contaminated pork with the larva in the pork tissue. And then the blue circle is the cysticercosis, and we're going to differentiate this in a second. So cysticercosis is an infection of both humans and pigs with a larval stage of the parasitic cestode Taenia solium. The infection is caused by ingestion of eggs shed in the feces of the human tapeworm carrier. So right below the pig, you're going to see like a rectangular thing and a circular thing. That's the proglottid on the right and the egg of Taenia solium. So what happens here is these eggs, for if you're not sure, a proglottid is a segment of the tapeworm body, and it's just loaded with eggs. It's a egg manufacturing machine in there. So both of these things would be highly contagious, highly infectious. So infectious that they don't require a developmental period outside of the host. So they're immediately infectious. Now, pigs and humans become infected by ingesting eggs or the gravid proglottids. Now, humans are usually exposed to eggs by ingestion of food or water contaminated with feces containing the eggs or proglottids, or by person-to-person spread. Now, that is not the case, at least that's what the researchers believe in this Florida gentleman. In his case, it looks like he infected himself through fecal-oral transmission caused by possibly poor, hand washing, hand hygiene. And once these eggs or the proglottids are ingested, the oncosphere is the larval stage of a tapeworm, and they hatch, and they invade the intestinal wall. They enter the bloodstream, and they just take off, migrate to different parts of the body, different tissues, different organs, and they sit there and mature until they grow into a cysticercosis, which is sort of a bladder-looking larva. Now, some cysticercosis, as in the case of this patient, migrate to the central nervous system, causing the very serious sequelae, neurocysticercosis. So he actually had these bladder-like larvae on his brain. So the cysticercosis part of it is different than the Taeniasis part, where, as I mentioned earlier, you get it by eating contaminated pork, raw pork, undercooked pork, and the oncosphere, the larva in the pig, will hatch in the person, and then it'll attach to the intestinal wall, and at that point, it'll continue to grow and grow and grow into a full-grown tapeworm. And that adult tapeworm will be producing eggs and shedding proglottids, and those will go out in the person's feces. So what they're thinking in this guy's case is he was eating this undercooked bacon for some time, and he must have got a batch that had the parasite in it. So he got the parasite in his intestine. He was defecating these Taenia eggs and proglottids, and perhaps he autoinfected himself. He didn't wash his hands well after going to the restroom, and may have contaminated food he was eating or put his fingers in his mouth and got the egg in his system. And instead of going around in the red circle there, the Taeniasis part, it went into the blue part, the blue section, the blue arrows for cysticercosis, because that's the only way you can get this very serious thing is by actually ingesting the Taenia solium egg. Now, the symptoms of cysticercosis vary depending on the location and number of cysticerci. They may develop in the skeletal or heart muscle, in the skin, in the subcutaneous tissues, in the lungs, liver, and other places, including the oral mucosa. In most places, in most locations of the body, it'll cause very few symptoms and spontaneously degenerate. However, if it migrates to the central nervous system, it can cause, again, neurocysticercosis, which is a very serious disease, very serious neurological. It can have symptoms resembling epilepsy, and you can have sudden death. It can be that severe. So that's kind of how the life cycle works, and that's the way I described it is pretty much probably what happened to this Florida man. And then just going to go over a few more slides so you can see what some of these things look like. This is the egg. This is the infective stage of Taenia solium. So it's just a small round egg, striated outer edge. And inside you may see like 6 hooks. That's called the hexacanth embryo. And this is what you ingest. And when it goes into your body, the internal part where you see the little lines, the little hooklets, that's the oncosphere. It's going to hatch, get out into, leave the intestine, get out into the bloodstream, and find its way to some part of the body, including possibly the brain. And here we have what the adult tapeworm may look like on the left. That's the scolex, that's the head. And you can see it has little hooklets at the top of the head and 4 suckers. And that's what's used to attach to the intestinal wall. The picture on the right is actually an adult Taenia saginata. I couldn't find a good picture of Taenia solium adult. And you can see how it's broken down into segments. Each one of those segments is a proglottid. And many of them are full of eggs, especially the gravid ones that are towards the end. And down at the bottom of the picture, you can see the little scolex, the little head of it. Now, Taenia saginata is a relative of Taenia solium. It is the beef tapeworm, and it's found in beef, cattle. But it does not cause cysticercosis. So the pathology that goes along with Taenia saginata, the beef tapeworm, is much less than Taenia solium. And if we go back to the egg real quick, I call it Taenia species eggs because you cannot differentiate between Taenia solium and Taenia saginata. They are identical in appearance. And then we have the cysticerci. These are the things that are going to be, in the case of neurocysticercosis, are going to be in the brain. And these are the things that were in this guy's brain. Little bladder-filled sacs, with a larva, and that's what causes the extreme pathology in the brain. And that's it. And I appreciate you listening and watching, and I hope you found it interesting, learn a little bit about the pork tapeworm and cysticercosis. And if you want to show your appreciation for this video, subscribe to the channel. Like this video, comment, and share it with your friends. And I will see you next time on Outbreak News TV.